Good health, they say, is very underrated, which makes good healthcare and an efficient health sector one of the most important things a country could have. And a country that doesn't take care of its citizens isn't doing a really good job, no matter how rich and developed the country is. And unfortunately, the United States is one of such countries. As shocking as this might seem, the United States healthcare system isn't the best in the world. In fact, it isn't even among the top 10 best healthcare systems in the world. Despite being so expensive, the United States healthcare system ranks 15th, behind countries like Canada, Denmark, Sweden, Norway, Germany, and the United Kingdom. The United States is in fact the only rich country without a universal healthcare system. This raises a ton of questions, like where does all the money budgeted for healthcare in the US go? Why is it so expensive? And why is it not the top ranking, despite the amount of money pumped into it, and the several healthcare schemes the US healthcare system has? In this video, we'll be examining how the US healthcare system works, all the various schemes put into place to make sure quality healthcare is readily accessible, and why it's so expensive. But before we get into the video, if you're new here, make sure you hit that subscribe button and become a member of our community. All set? Without wasting any more time, let's get right into the video. Let us start by looking at the factors that make a country's healthcare system effective and cost-efficient, and what puts it on the top-ranking list. To be a top-ranking healthcare system, there are 5 factors that the country has to get right. They include expenditure, quality, availability, population health, and upfront cost. Expenditure. Expenditure refers to the amount of money the country budgets for its healthcare. In 2018, the budget for healthcare in the US increased by 4.6%, bringing its value to a whopping $3.6 trillion, which is about 17.8% of the nation's GDP. This budget allocates $11,172 for each person, yet healthcare is still very expensive. Meanwhile, Canada budgeted $264 billion for healthcare, which is 11.6% of the country's GDP, yet it has the best healthcare system in the world. Denmark, which has the second best healthcare system, spends just 10.4% of its GDP on healthcare. Crazy, right? Keep watching. It gets even more shocking. Quality. This refers to the quality of the healthcare system and the efficiency of the professionals in that field. There's no doubt about the quality of healthcare in the United States. It's obviously way above standard and is one of the best in the world. Availability. Availability refers to how accessible the country's healthcare is, irrespective of class or status. For the United States, this is a debatable topic, seeing that most physicians refuse to go and work in some remote areas, and some people still have to travel distances to gain access to proper healthcare. The healthcare of the United States can therefore be described as fairly accessible. Population health. This looks at how effective the healthcare system is, and how healthy the people of the country are. This is also a very debatable topic, as the rate of death in the United States is still high. Maybe not as high as before, but still significantly high. This just goes to show the effectiveness of the healthcare system. In 2010, the leading causes of death in the United States were lung cancer, stroke, coronary artery disease, chronic obstructive pulmonary diseases, and road traffic accidents. Low back pain, neck pain, anxiety, depression, and musculoskeletal disorders cause the most disability in citizens. Risk factors like high blood pressure, high blood sugar, and alcohol abuse are still very relevant. The United States has also dropped from 14th to 26th for healthy life expectancy, with an average of 48,000 preventable deaths yearly. So, what do you think? Is the United States healthcare system effective in keeping the population healthy? Me? I'd say not so much, especially for the lower class. Let us know if you agree, or if you have contrary opinions in the comment section below. Upfront cost. This refers to the amount of money a patient has to pay upon receiving healthcare services, and this is where the United States is seriously lacking. Despite allocating up to $11,000 to each person in the numerous healthcare schemes, the cost of healthcare is still horrendously high. Not even insurance can save you. In a study published in Health Affairs, a health policy journal, it was revealed that the prices paid for the healthcare services in the US are much higher than in most countries. And even though these countries pay less than half the amount the US pays, they have gained about 6 years of life expectancy more than the US. Healthcare in the United States is provided through a combination of public health funding and coverage through some health schemes and private insurance. Before we look at how private insurance works, let's look at some of these health schemes and how they actually work. Medicare. Introduced in 1966 under the Social Security Administration, Medicare is a national insurance program put in place to provide health insurance mainly for older American citizens, aged 65 and upwards. It also caters to people with disabilities, irrespective of age, as well as people with end-stage renal disease and Lou Gehrig's disease. According to the 2019 Medical Trustees Report, Medicare catered for the welfare of nearly 60 million people, with about 8 million of them being younger people, while the others were at least 65 years old. Medicare covers about half of the medical fees of the enrollee, while the remainder comes from private insurance and/or additional public insurance schemes, like the Part C or Part D Medicare Health Plan. Speaking of parts, Medicare is divided into 4 parts: Part A, B, C, and D. Part A is your regular healthcare insurance that covers payment for hospital services, including admissions and skilled nursing. This part handles the full medical bills of the admitted patient for the first 60 days and a part of the bill for the next 30. After 90 days, the patient has to foot the complete bill. Part B covers services referred to as outpatient services, as they are not received on admission to the hospital. It's either the patient goes to the hospital for care and returns the same day, or the healthcare provider or worker administers healthcare services in the patient's house. Part D covers self-administered prescription drugs that don't require the services of a health professional. Several leaders have contested the benefits of Medicare, seeing that older people require more medical care, yet have the lowest incomes. The solution? Have them pay contributions while they're still working, as suggested by Robert M. Ball, former Commissioner of Social Security. Medicaid. Medicaid is just like an upgraded version of Medicare with more benefits. It's the largest funding program in the United States for medical and health-related services. It was formed to help with medical costs for people with limited resources and little or no income. The Health Insurance Association of America describes Medicaid as a government insurance program for persons of all ages whose income and resources are insufficient to pay for health care. Funded jointly by both state and federal governments, this program has successfully provided free health care for about 74 million Americans, most of whom are disabled or living with low income as of 2017. In 2017, the total cost of these programs was $600 billion, with the federal government contributing $375 billion, while individual state governments paid the remainder. According to research, this program has been able to provide free health care, making it accessible to financially insecure citizens, and has generally improved the welfare of American citizens. There is also the very controversial Affordable Care Act, also known as Obamacare. It was introduced in 2010 by then-President Barack Obama to provide affordable health insurance coverage for all citizens of America. It was also designed to help the customers bypass the tactics of most insurance companies that could drive up the cost and restrict the quality of health care they get. There's no doubt Obamacare has been really beneficial, especially to unemployed people, people of low income, and those living with disabilities. It covers people who don't get health insurance because of a pre-existing medical condition, as most insurance companies won't cover for such conditions. With Obamacare, there are no time limits, and basically, everything costs less, including prescription drugs. However, on the flip side, this program had a lot of technical problems. It caused taxes to increase significantly to help pay for the program. Not everyone likes this part of the bargain. Most businesses are also cutting employee hours, so they don't have to pay for employees' health insurance. Looking at the bigger picture, Obamacare has done more good than harm, contrary to what most people claim, and experts have said that this scheme would only get better, and in the long run, it would have an overall positive effect on the lives and welfare of American citizens, and even on the state budget. Aside from these 3, there are several other healthcare insurance programs, like the Veterans Health Administration for military vets who are struggling with mental illness. There's also TRICARE, formerly called the Civilian Health and Medical Program of the Uniformed Services, a health program for members of the U.S. Armed Forces, military retirees, and their dependents. In addition to all these programs and schemes, we also have private health insurance. But as I said, not even insurance can save you from ridiculous health bills. I'll explain why in a bit. But before then, did you know that medical bills are the leading cause of bankruptcy in American families? Every 30 seconds, an American family goes bankrupt from medical bills. Yes, it's that serious. Now, about insurance. Insurance can be provided by either the employee or from personal accounts, and they do not usually pay for everything. With an insurance plan, there are 4 types of payments you may be required to make, and depending on the package you buy, these payments might be worse than what you're trying to cover. The first is the premiums. This is the payment you make, even when you don't fall sick, and they can be pretty high. The next is co-insurance, which is a percentage of the cost you pay, and again, depending on your insurance plan, this percentage might be low or high. A deductible is what you pay before insurance pays for anything, so even with insurance, your bills might still be pretty high. A copayment is what you pay for every visit to the hospital. Medical bills can be pretty high, even with the insurance, and this is largely because private hospitals are given the freedom to charge as much as they want. When paying your hospital bill, you're paying for administrative cost of drugs, wages of the professionals, and even for the possibility of doctors being sued. Yes, you pay legal fees, just in case you turn around and decide you want to see your doctor. There was a story of a woman who went to the ER because she hit her head and came out with a bandage, an ice bag, and a massive hospital bill, totaling $5,751. Further breakdown of the bills of a surgery patient showed that he paid for the anesthesiologist, the orthopedic surgeon, separately, and about $110,000 for an assistant surgeon. The hospital charges show that he was charged $53 for a pair of non-sterile rubber gloves, and an even higher fee for sterile gloves, which brought the fee for his gloves alone to $5,141. Basically, in the US healthcare system, you're charged for everything, including alcohol swabs and the small plastic cups they put your drugs in. And due to the fear of such huge bills, many people prefer to stay home and nurse their illnesses until it worsens drastically, and they now have to pay more for a more intense healthcare service. And until hospitals are checked somehow to make sure they don't overcharge their patients, this system definitely won't progress. And with that, we come to the end of today's video. Let us know how much you enjoyed it in the comments section down below. And don't forget to like and subscribe to this channel. Stay tuned for more amazing content. Bye!